have played a major role in guiding the manner in which this disease is handled worldwide. To begin with, what exactly is IHR 2005? IHR 2005 is a principal instrument that binds 194 countries across the globe, including all member states of the World Health, to outbreaks of infectious diseases and other public health emergencies. And it is through the use of these regulations that countries are able to determine whether or not a particular event constitutes a public health emergency of international concern. And in this day and age of COVID-19, this disease has been termed as a public health emergency of international concern. In the past years, the use of the IHR instrument has led to the declaration of other disease outbreaks, including in 2009, H1N1 pandemic, polio and Ebola in 2014, Ebola once again in 2019, and the Zika virus in 2016. Now, beyond outlining measures to be used in the management of an outbreak, the IHR regulations are also able to provide a legal basis for the attestation of various documents applicable to international travel. This includes documents that govern travel across ports, ground crossings, and as well as providing a legal framework for defining what rights different countries have in the execution and the management of public health events and emergencies. Kenya is a signatory of IHR 2005, and through the Ministry of Health, Kenya is obliged to comply with IHR instruments provisions. And this includes to prevent and protect against, control, and provide a public health response to the international spread of a disease while avoiding unnecessary interference with international traffic and trade. And finally, this IHR instrument also provides important safeguards that are able to protect the rights of travelers, the rights of data transfer when it comes to traveling, when it comes to surveillance activities, issues that deal with informed consent and non-discrimination as we apply health measures under these regulations. The IHR mechanism also provides a stringent reporting and notification mechanism for disease outbreaks. And part of the guidance of IHR is that disease outbreak data and information should be shared in an accountable, open, and transparent manner. And that is why we continue to address you, providing you with daily press briefings on the current state of coronavirus in the country. And in this regard, throughout the COVID-19 response, another key element of IHR 2005 is a provision of information, particularly information that concerns risk communication and being able to pass messages that are able to effect behavior change and communication. And so in this regard, the Ministry of Health, together with other health sector stakeholders, and in line with the IHR guiding framework for communication, has continued to disseminate health information through various media, including print, electronic, in order to give you guidelines on how to reduce the transmission of COVID-19, ways of protecting yourself, and we continue to emphasize on the 3 key interventions: washing your hands with soap and water, masking, and adhering to physical distancing. This targeted messaging has taken place in the form of SMSs, sponsored adverts in different media platforms, including social media platforms, as well as utilizing a community approach when it comes to targeting the segmented audience we have in our country, particularly the youth, the middle-aged, and the elderly who require to shield from coronavirus. And today, as we release the 147th COVID-19 brief, we would like to emphasize that it is important to ensure that we relay the right information, especially on transmission, as well as how to manage this condition. We continue to see information in different platforms, and some of this information digresses from ways in which we can manage COVID-19. information containing certain concoctions that you can take that will be able to cure you. And it becomes important to ensure that everybody adheres to the containment measures and that we are all aware that passing false information can actually hamper the efforts against this disease. The Ministry of Health continues to appreciate the support of all stakeholders who are working with us, one, in relaying correct information, two, in supporting behavior change communication, and most importantly, our healthcare workers who continue to serve and fight and help us bring down the infection rate and transmission rate of COVID-19. We'd like to remind you that we continue to hold the well-being of our frontline health workers as a priority as we fight COVID-19. The provision of quality personal protective equipment continues. We are working to ensure that this equipment is approved by the Kenya Bureau of Standards and working with various county governments to ensure that there is no delay in provision of this equipment. We have also gone ahead and addressed and anticipated the increased workload of our healthcare workers, and through the Universal Healthcare Coverage Program, we've been able to employ 5,000 healthcare workers across various cadres so they can relieve the anticipated heavy workload in this age of COVID-19. Regarding the mental health of our healthcare workers, the ministry continues to put in place a care line, a psychosocial care line for our healthcare workers, where we have a set number of psychologists deployed, ready to attend to any queries or any concerns or any remedies that are required when it comes to mental health. We've also employed, through the different medical associations, peer-to-peer mentoring of healthcare workers as they continue to fight the COVID-19 pandemic. With regard to occupational risk and safety, we are working with different organizations who are involved in the design of our workmen compensation package. This has been submitted to Cabinet and is awaiting ratification in order to be able to protect the welfare of our healthcare workers. Turning on to the COVID-19 statistics today, we have 580 people who have tested positive for the virus from a total sample of 5,458, all tested within the last 24 hours. This brings now to total the number of positive cases in the country to 29,334. From our cases today, 530 are Kenyans, whereas 50 are foreigners. 336 of them are male, while 244 of them are female. The youngest is a 1-year-old baby, and the oldest is 92. With regard to distribution of cases by county, Nairobi County leads with 375, Kiambu 53, Machakos 23, Busia 17, Mombasa 15, Nakuru 15, Kajiado 14, Kisumu 12, Lamu 10, Nyeri 7, Laikipia 3, Baringo 2, Kisii 2, Turkana 2, Vihiga 2, Garissa 1, Bungoma 1, Murang'a 1, Nyandarua 1, Siaya 1, and Trans Nzoia 1. We have provided a distribution with regards to the sub-counties from each county, and this will be availed in the statement. Today, we are delighted to report that we have 198 patients who have recovered from the disease, and from this number, 119 are from the home-based care program, whereas 79 have been discharged from various hospitals. And this therefore brings the total number of recoveries in the country to 15,298. And we continue to appreciate our healthcare workers for their excellent work done. Unfortunately, however, we've lost 5 patients to the disease, bringing our fatality count to 465. And our heartfelt condolences to the families and friends for the loss of their loved ones. We thank you. We now welcome a question and answer session.
Jina langu ni Busara Naman kutoka Ebru TV. Masaa machache yaliyopita tumezungumza na viongozi wa madaktari KMPDU na wamesema kwamba takriban madaktari 300 kutoka Nairobi Metropolitan Services watagoma. Wametoa makataa ya siku 7 wakilalamika kwamba mishahara yao imechelewa, baadhi yao hawajalipwa na vile vile wengi wao hawana vifaa vya kujikinga PPEs. Je, upande wenu kama wizara mna yapi ya kusema kuhusiana na hali hiyo?
Dr. Ariel, just a follow-up to the same question, and they are citing that the infights between NMS and Nairobi County government is one of the reasons that is contributing to their resolution to strike in the next 7 days. Perhaps what are the immediate actions that you're going to take? You've mentioned time and again that their welfare is of utmost importance to you. Thank you.
Thank you.
Nancy Okware kutoka KBC. Umezungumza kuhusiana na kuhakikisha kwamba madaktari wanalindwa kwa kuvalishwa ama kupata yale mavazi ya kujilinda ama PPEs. Lakini tumepokea malalamishi kutoka kwa baadhi ya wagonjwa wa corona, hususan katika baadhi ya hospitali za umma, na wanasema ya kwamba wanalazimika kulipia yale mavazi. Je, kama wizara mmepokea hizi taarifa na mnafanya nini kusuluhisha? Asante.
Thank you. Thank you for those questions. Kuna swali imeulizwa kuhusu mgomo ambao madaktari wameapisha in 7 days time. And what I'll do is that I'll respond to this and clarify in Kiswahili. Yes, we've had discussions with the NMS team as well as the Doctors Union in Nairobi. And I'm happy to report the official position from the Ministry of Health regarding these issues. One, to begin with, COVID allowances have been paid for all staff in Nairobi County. We have the records to demonstrate this, and these allowances, we have confirmation from NMS that these were paid to the healthcare workers. Regarding the PPEs, we continue to ensure that our healthcare workers have the right PPEs. We have, in fact, and Kefa will bear us witness and provide more information, initiated a 4th round of distribution of PPEs. And so the healthcare workers should remain confident that they will get the PPEs that they need. Additionally, we've put in place mechanisms, and we continue to encourage each and every healthcare worker, should you come across a PPE that you feel is defective in any manner, our doors are always open. My door is always open. Come in with that kit, and we shall take the necessary action. Concerning the issue of promotions, designations, yes, we are aware there is a small challenge, and we are working on it. Following the institution of the NMS, there was a slight delay in the transfer of payroll from Nairobi County to the NMS. However, I'm pleased to note that the teams involved in ensuring that this transition takes place have given assurances that they are working on this, and there will be good progress to ensure that all healthcare workers are transitioned from the former Nairobi County into the NMS service. That being said, there's good progress there. I was made aware this morning that over 2,000 healthcare workers, these are non-doctor workers within this institution, have actually gotten their promotions and redesignations, and this was effected. Further to this, regarding the remaining doctors, I'm made aware again from the NMS team that a budget has been availed, and therefore what is missing is just that small transition period which is being attended to, so that the doctors are able to then get their promotions and their proper designations. So we are working on that. Regarding the issue of ensuring that doctors have isolation facilities, quarantine facilities, we continue to partner with NMS as national government, and that facility is available. The facility actually has occupancy that can be taken should any healthcare worker require it. And this facility is available at Kenyatta National Hospital, but also at Royal Tulip Hotel, and it's available for all doctors. Now, regarding the NHIF cover, yes, there was a delay in ensuring that workers in Nairobi County are covered, particularly our healthcare workers. But again, fantastic progress. One, a budget is available to cover them. Two, last week, that's on the 7th of August, negotiations were initiated at NHIF, and these are due to be completed within the coming week to ensure that these healthcare workers actually receive an enhanced cover under the civil service scheme. So all these issues we're dealing with. And so we feel that continued engagement, which I'm made aware actually happens on a monthly basis between the union and the NMS staff, is ongoing, and these issues shall be addressed and completed in an amicable manner. I'd ask Dr. Kuria to translate it in Kiswahili, I think. Right, but anyway, what we're saying is tumeweza kuzingatia yale masuala ambayo yameletwa na wakurugenzi wa afya katika kaunti ya Nairobi. Ndio kumekuwa na shida kuweza kubadilisha ile payroll kutoka kaunti ya Nairobi hadi kwa Nairobi Metropolitan Services, lakini haya mambo yote yametatuliwa. Ya kwanza, PPEs zimo. Daktari Kefa hapa ndio kiongozi wa komiti ambayo ina distribute PPEs kwa nchi, na ataweza kutueleza kama ameweza kuwapatia wafanyikazi wa Nairobi PPEs. La pili, tumesema kama uko na PPE ambayo ina hitilafu yoyote, kuja huku Ministry ya Afya, kuja kwa Wizara ya Afya. Tutaweza kuchukua hiyo PPE, kuikagua na Bureau ya Kenya Bureau KBS kuweza kuangalia kama hiyo PPE iko sawa kwa utumizi. Mambo ya NHIF, bima ya NHIF, hapo tunaenda kutatulia hiyo jambo. Budget iko, pesa zimo, na hawa wafanyikazi wataweza kuandikishwa katika bima ya NHIF. Allowances za COVID zimelipwa. Hakuna mtu yeyote katika Nairobi County ameweza sema kuwa kuna allowance ambayo hajalipwa ya COVID. Na kama kunayo, huyo mtu akuja ajitambulishe hapa katika Wizara ya Afya, tutaweza kutatua hilo jambo. Sasa ningependa kumwalika Daktari Kefa aweze kutueleza kuhusu mambo ya PPE na mambo ya distribution.
Thank you, Waziri. What we are doing in this ministry is that we, as you are aware, we continue getting donations from well-wishers. You are also aware that the government of Kenya, through the ministry, we have also given money out to the counties, which is supposed to be supporting this area of protecting, buying things which are supposed to protect the issues of COVID. Allow me zero down on how we are going about the donations. All donations which are coming here are subjected to a quality test to ensure that they are meeting the standards. So any donation that is coming and doesn't meet the standards, we don't take. From there, the donations move to KEMSA. And then what we do, based on the burden, the statistics that we read to you here, which are coming from the counties, we divide all donations of all sorts of PPEs included, and the counties get an extra latitude to be able to draw free, that they don't pay, free additional COVID mitigation items from KEMSA. They can either come direct and pick, or KEMSA supports by transporting all those donations to the county. And we have been doing this progressively at any time. Even whatever was given this week, we have already given, you can actually see the spreadsheet that we have given, and we cover both those facilities which are within the county and those which are under national government, like KNH, KU, MTRH, and all those other facilities, including the supportive government agencies like immigration and all other those places. Thank you, Waziri.
Asanteni sana.
Pata smartphone mpya kuanzia 20 bob daily pekee.